so that we have this available should we need to reference things. Our website is in development, and we will have the information available for the website for historical review in the future. So looking at the up-to-date status across South Carolina, we're very excited to see that continued steady level of 48%. We talked in our last session that CMS and the White House is really encouraging us to ensure our vaccination programs are in place to allow, they would like us to have a goal of over 75% for up-to-date status in our facilities. Lots of tools available and a great conversation today about how we can develop our vaccination programs to ensure that continued compliance is in place, but most importantly, to ensure that we're offering our residents and their families that ongoing choice to make sure that they have their wishes being honored and their outcomes are the best they can be. Okay, we have the current case as of April 2nd. It's showing 90 counts across the state with a 5.8 COVID rate. So we did bump up a few weeks back, and we are seeing it down. It is important that we keep that in perspective of how we look at the community spreads. So we know that the community levels continue to be low across the state, which is always good. Green is our favorite color. But when we look at the community transmission rates, we see that those variants are in place. And so we have high, substantial, moderate, and low areas. If we're in those high areas, even though the PHE is coming to a close, we still have to follow those standards of practice from an infection control perspective. As operators, we should be looking at our systems and our policies and analyzing what is going to be the best method that we can bring into place to ensure that we have that lower mitigation, or we lower the mitigation risk for our residents and families and our staff. So thinking about what type of PPE equipment you're going to be utilizing. Maybe we're seeing in these high areas of spread, increased cleaning of high touch surfaces, increased signage. Maybe a notice is going out to families and letting people know, please be mindful, we're seeing this high level. If you're not feeling well, it may be allergies, but we're also here to help you with a test or a swab just to ensure. Just kind of thinking about how we can advocate to those needs. And we do still see some outbreaks happening across the state. So we do want to be mindful about that as we're managing our operations. So with that, I'm excited to introduce our speakers today. We have Mary Laughlin, April Faulkner, and, oh my goodness, Cindy Warner. Did I get that correct, Cindy? I'm sorry.
You did. Cindy Warner's great.
Perfect. From HQuinn, as we had talked previously, we are the QIO, CCNE is the QIO for South Carolina. HQuinn is our umbrella organization, and we have great representation across 4 different states in serving the quality improvement needs of our facilities. So we're excited to have them here speaking about vaccinations and our program. With that, I'll hand it over to our wonderful presenters today. Thank you so much.
Thank you, Alyssa, and welcome everyone to today's session that we are calling Vaccines. Are you up to date with expectations? A little play on words there. Next slide, please. As Alyssa alluded to, today's event is brought to you by the Health Quality Innovation Network, or HQuinn, and we are your CMS-appointed Quinn QIO with the goal to assist nursing homes in Kansas, Missouri, South Carolina, and Virginia with quality initiatives at no cost to your facility. Next slide, please. At this point, everybody should be in listen-only mode. There will be an opportunity to ask questions at the end, but please feel free to use chat to ask questions and make comments as we go along. Alyssa did say that the presentation and resources from today's session will be provided. It's being recorded, and you should receive that, I believe, in probably about 24 hours. Next slide, please. So I'm Mary Laughlin, Senior Quality Advisor and Board Certified Infection Preventionist. And I'm joined today by Cindy Werner, our resident pharmacist and a wealth of knowledge who has been involved in facilitating vaccine conversations in clinics since the onset of this pandemic. And last but not least, we have our communication wizard, April Faulkner, who makes these presentations look professional, and she monitors chat. So please keep April busy with your questions. It's our hope that the presentation will help you with your system of tracking vaccination status, provide you with some tools to increase vaccine uptake, as well as tools to assist with the education associated with vaccination. Next slide. So if a surveyor walked into your building today and asked for a list of every resident and staff member that's been vaccinated with dates of administration, would you have total confidence in your ability to respond with documentation? How would you fare if they asked for a list of every single current resident or staff member who has not received the vaccine, or a list of those who are partially vaccinated but refused the rest? Who is keeping track of when the next doses are due? Next slide, please. So you're going to need to maintain solid documentation of those vaccine administrations, as well as declinations and the education provided about each of the vaccines. Here are a few things for you to reflect on related to your own process. Think about, and I urge you to think about how to decrease the fragmentation of responsibilities and improve communication between those responsible roles. Next slide. And that brings us to a polling question. We just want to see what your response is in terms of whether or not you feel like your processes for tracking and improving vaccination rates at your facility are solid. It looks like a good percentage of you are really on top of your vaccine tracking, and that is awesome. You're absolutely doing the right thing for your residents and your facility. If you're behind in this regard, then you need to start taking steps to ensure that you're ready to present those details in a survey. If you saw the most recent QSO memo, they're really expecting very solid documentation for both vaccine status and education about vaccines. And at this point, I'm going to turn it over to Cindy.
Next slide, please. Okay, well, great. And once again, I'm so glad you guys are here today. Pictured on this slide are definitely not all the vaccines that a person should take, but the key ones, especially for in nursing homes and assisted living facilities. So primarily, I would think you want to make sure you have good recording and tracking of the 6 listed here. As you can see, all of these vaccines are important. And please remember, and you're going to hear me say this a couple of times, I'm a retired high school teacher as well as a pharmacist. So in my learning, you have to hear something 3 times for it to stick. So you'll probably hear this 3 times today. But vaccinations are the best preventative tool we have today. So the more people we can get to want to be vaccinated and vaccinated, we're preventing a lot of adverse events, disease states, and complications. Important also is, I want to mention 2 things, and I'm sure you guys know things have fluctuated with COVID-19 information, but it looks like at this point that the seasonal flu vaccine and the COVID vaccine are going to sort of parallel. So they will still, while they're finalizing the official approval, it has been approved by the FDA, the CDC's finalizing the guidelines. There's a big federal bureaucratic process it all goes through. But just kind of keep in mind that come end of August, September, you'll probably want to be encouraging flu and COVID, and they can both be given together. So since we know ahead of time, those 2 are going to kind of be paired up seasonally, let's think about the others. So the others, pneumonia, shingles, tetanus, hepatitis B, most folks are usually up on their tetanus and their hepatitis, but as people age, we've got to remember when the revaccinations are due, especially for tetanus. Shingles, while you don't hear a lot of press about it, except for usually the manufacturers of the vaccine itself, shingles is a critical vaccine, especially as people age. So I did want to let you know shingles and pneumonia could be topics you guys could be working on with your residents right now and get it out of the way and done before we hit the seasonal ones. At the bottom of the slide, you'll see there's a bulletin board link, and that's a great link to provide some additional resources. And I would encourage you guys, all the links on the slides, at least take a look at, pick out your favorite ones and save them so you can refer to them easily when you need them. Next slide, please. So I know I just mentioned a high level. I wanted to go a little bit deeper, and I told you I'm going to say things at least 3 times, so you guys, it'll stick a little bit because I know how busy everyone is. But here's some more details on some of the specifics of the vaccine. And I'm sure most of you are aware we do have a new pneumonia vaccine, Prevnar 20, that came out and was approved and released during COVID. So that just added to a little bit of the confusion going on with COVID. But we'll go over some specifics about that Prevnar. But just keep in mind this, Prevnar is a one and done. That's what pharmacists say. One vaccine and you're done. You get the Prevnar 20, 65 and older, you don't have to have another one according to the recommendations at this time. Tetanus, as I mentioned before, is once every 10 years. So this really highlights the importance of accurate and accessible record keeping. I mean, I don't think you would want just one person responsible in your facility for that, because there should be opportunities for multiple staff members to be able to check that. Once again, we've got a little link at the bottom just to keep you guys encouraged and resources available. And I think Mary and Alyssa both mentioned all these resources are no cost to you. Now, resources are only good if you access and use them. So make sure you take the opportunity to use what we're trying to provide to help you. Next slide. Okay, let's go over, and this is where I have a little bit of fun. One of my past lives, I was a competitive college athlete. So when you're trying to get all your records up to date and you want to be able to, if someone should come in or if there should be an audit, you want to be able to just pull that stuff out and say, here it is. And you've got it all organized so that they don't even know what questions to ask because you're so organized. So one of the things, and it is, sometimes you have to get out your little magnifying glass and put on your detective hat, because vaccine records are not always kept well. And so I'm going to go over just a little bit about the importance of how to have a routine process to get as much information as possible. So if you could click one more time. The first thing you're going to want to do is review the medical record. And obviously, the hope is that there will be a lot of good information in that medical record. The reality is there's usually some omissions. So, you know, if you see, especially of those 6 vaccines, if you don't see a record of those 6 vaccines, those priority ones, you want to dig a little deeper. So let's click enter again. The next step, if the record doesn't have everything, and I did want to mention, when you are looking at the records, you know, think about the records you received, maybe the chief medical officer's records, their hospital, you know, discharge record to see if they received any, your consultant pharmacist, that can also be another place to look for that. But your MARS, you can refer to those, nurses' notes, physician orders. You know, sometimes things are ordered and then they're never actually put into a permanent record. But if you don't have everything you need, you want to continue your detective work. Now you're becoming an advanced detective, and ask the resident. Now let's think about that. When you're asking the resident, you want to make sure you're using their preferred language. You want to make sure that they can hear you. And you want to make sure that they have access In other words, sometimes, and you guys know this because you're on the front lines, you have to almost yell to get an answer. You close the door, you speak very loudly. Sometimes you use hand signals, sometimes you write things down. So just be prepared to meet them where they're at. Basically, you would want to treat this as you would any MDS interview. If the resident rarely or has difficulty in understanding, you could probably skip this step and move to the third step. So let's hit the net. I think you need to hit it twice, Alyssa, to get to the third step. Yeah. So the next step would be always to look at the responsible party or the legal guardian. Now, as you guys are seeing, this is like a major detective case. And pharmacists do this all the time in the community setting, trying to figure out what people need and what they're taking. So that's why I like to break it down this way, because I don't want you guys to give up. I mean, complete the task so you can have an accurate recording, but always document everything you obtain in the interviews, whether it's the resident, whether you got it out of the chart or the medical record, the responsible party, or just anywhere, and put where you got it from so that people that might be following behind you know where to go. So let's hit enter 2 more times, Alyssa. Okay, if you've gone through all these 3 steps and you've still got voids. Now, let me remind you, the most important voids to recognize are those 6 vaccines that we mentioned earlier. But if you still have voids, you're going to want to first check with your medical director, but you want to make sure that that resident gets vaccinated with the vaccines that are recommended by the CDC or the Advisory Committee on Immunization Practices, and that's ACIP. That usually means checking with the doc, getting consent, and I know that sounds like it's a lot, but if we can get that done, and that's why I suggested think about different steps. Like now you could really focus on shingles and pneumonia. We know COVID and flu is coming up. You also might see that maybe they didn't get the bivalent booster. So we'll cover some of those things further on. Next slide. So in order to see the status of all the residents, we've developed 2 comprehensive tracking spreadsheets. One for the COVID vaccinations and another one for flu, pneumonia, TB, and some of the other vaccinations that we've mentioned. You may be wondering, why are there 2 spreadsheets? I mean, we're only talking maybe 6 to 10 vaccinations. Well, over the next few slides, you'll see just why. But these are interactive spreadsheets. They are a helpful resource, and each tracking tool contains a lot of detailed information as well as formulas built into them. So it reminds you when they might need a follow-up vaccine. And that's also the reason why we couldn't get it all into one. So with that, I'm going to say, take it away, Mary.
Thanks, Cindy. So we can go to the next slide and just bear with us as we review these next few slides. It's really hard to see a lot of detail regarding spreadsheets on PowerPoint slides. So as you can see, we have highlighted some of the rows just to show you, especially if you don't use spreadsheets in your everyday work. We don't want you to be intimidated. And the more you use these Excel spreadsheets, the more familiar you'll become with its capabilities. And you'd really have to work hard to mess anything up permanently. So everything that you might attempt to do can be undone. If you try to add data into a row and then into a cell and in a spreadsheet, and it won't let you, you're going to want to look for that downward arrow to the right of that space. That means it's been pre-populated. Those cells have been pre-populated with options that drop down when you click the arrow. For instance, if you're entering some vaccine administration information regarding residents under the booster name column, you'll see that drop down containing vaccine manufacturers. Next slide, please. As you can see, the vaccine tracking tool also includes detailed instructions, and it's really important to review all those instructions to really get a framework for how this is supposed to work. And since it's difficult to see the detail in the spreadsheet rows on these slides, we've pulled out the initial headers so you can see the tracking categories there that include the resident information, the vaccine type information, first dose details, second dose details if applicable, third dose details if applicable, and then the bivalent booster doses details, and some reporting prompts for you to use. And all of these are optional. And you can use the categories that apply to your needs and not use others, and it will still result in the same tracking capability. Next slide, please. The first three categories deal with the primary series. As you add information here, information is compiled into charts that accompany the tracking tool. Next slide. And as you can see, our tracking tool also captures booster doses and additional dose information. These fields are, as I said, optional, and especially in light of the presence of the bivalent booster, which has its own fields. But if you have longstanding residents, it might be useful for you to know what they had. If this is a new tool for your facility and you've tracked that information in another way, you can ignore those booster fields. The spreadsheet really provides a single at-a-glance view of COVID vaccinations for the entire facility. That's why we built this, in the hopes that it would really support vaccine administration programs, especially during a survey. And I think April's going to drop the links to both the COVID vaccine tracking tool and the additional tracking tool for pneumonia, TB, and pneumococcal. Next slide, please. This section deals with the bivalent booster. Please remember that it's really important to document the refusals as well as the given doses. Surveyors are absolutely going to expect to see that. Next slide. So this looks like a lot, but as I said, the more familiar you become with these spreadsheets, the more understanding you'll gain of why each column exists and how this actually works to provide you with some very valuable charts. So when you're inputting the vaccine data, you'll enter the date of the doses of vaccines. Having all of this information in a single location is going to make it a lot easier to coordinate and monitor pharmacy services or schedule clinics. It also could help with your discharge planning for those short stay residents. And we can go to the next slide. Bear with me a second. Onto our resident influenza, pneumococcal, TB vaccination tracking log. This is very similar to the COVID tracking tool in that it will calculate dates as you enter. There are columns to enter the manufacturer, the lot number, the expiration for all three of the vaccines. The flu and TB are pretty straightforward. When you enter, in fact, when the PPD is administered, the spreadsheet is going to flag when the resident needs that PPD to be read, which is a beautiful thing. In this example, we have intentionally highlighted the 4 pneumococcal vaccine options. The spreadsheet will help to guide you on which one is recommended, as well as when the next dose is due, if applicable. Next slide. So we've also included in this tracking tool a conditions tab that's going to help you determine what pneumococcal vaccines your residents are eligible for and when. This is a really easy to follow table that aligns with the current ACIP guidelines and are categorized to help determine how many doses of each vaccine to administer to a resident, as well as the recommended timing. And then each vaccine is further divided by age and underlying medical conditions. So this tool really provides you summary charts for cumulative vaccines and even vaccines by unit. Another thing that it provides is a visual representation of your program. When you enter the data of the vaccines administered and those refused, the spreadsheet automatically provides you with a summary graphs and charts. they don't contain any identifiable resident or staff information. Therefore, it can be shared with other internal team members at your facility as your policy allows. I'm thinking your QAPI committee or your infection prevention meetings would be great places to review those graphs. And at this point, I'm going to send it back to Cindy.
Okay, well, before we get into the agency guidance specifically, as you can tell, if you have your vaccine information all over the place and not in one place, the spreadsheets that Mary just went over give you an excellent way to coordinate and accumulate that so it's easily accessible for the leadership team, for the head nurse, for LPNs to look at as they're going into the rooms. I mean, it should hopefully be available to all staff members that are interacting with residents so that they have the most up-to-date information. Maybe your facility also has care plans to cover these policies and procedures, and that can be coordinated in. If not, discussing and developing a way to incorporate and utilize and have accurate surveillance, ongoing systematic collection, analysis, and interpretation can really keep staff positive, encourage folks to support each other, and just build a strong team. I think everybody in here, and I know this isn't a polling question, but I want to make sure y'all are not asleep. If you can put into chat, you know, how you would sense if there was one place that you could go to get all this information. If a resident asked or a caregiver, how many times does the front desk receive calls? Hey, what vaccines has my mom gotten? You know, to have those things easily available. But then the flip side of it is if a resident isn't getting vaccinated, to know that, or to know that there's a contraindication so that you're not going in and asking them for something that they shouldn't have. I think that's really important as well. Each resident has the opportunity to refuse, and Mary mentioned, and we'll have some resources. It's important to document those refusals. The current auditing and new guidelines, there's a requirement for education and asking. And if you document a refusal, that's proof that you approached it and tried. If you don't document a refusal, you're going to have to prove that another way. So, you know, just kind of keep that in mind as you're setting up your policies. The medical record is extremely important to have it concise and a good summary in the event that a person might need to go to the hospital, so that there's an accurate record to be able to send there. So I've just mentioned a few things. If you guys can think of some others, put it in chat. This is Alyssa told me this is a good group and you guys are very casual and it's a lot of sharing. So I like feedback. So if I've left out anything that you guys are using records for, please put it in chat, because Mary and I like to always improve our presentations as well. So what I'm going to cover next is agency guidance, the CDC guidelines. And I tried to find, if you ever have been searching on the CDC website, they have a plethora of charts and guidance and different places to find it. And it always seems kind of hard to find exactly what you need. So I've picked two that hopefully will, if you like them, save them as your favorites so you don't have to go digging and you can just pull it up. Let's hit the next slide. So hopefully, and I'm sorry this isn't big that you can see it and read everything, but this is a summary of the recommended adult immunizations by age group. Now, clearly in the nursing home, you can have across the spectrum of age, but obviously a lot of them are usually over 50 or 60 years old. So this chart keeps you up. All right, here's my third time. You might hear it 4 times today, but you'll see the 6 vaccinations that we talked about in as far as recommended, minus the COVID. The COVID one's not in here. but you'll see shingles, you'll see the tetanus. It's usually given as a Tdap shot. You'll see the influenza. You'll see the pneumococcal. You'll see the Hep A, the Hep B. I mean, Hep B is the one we want to make sure of. And hopefully most folks have had their Hep B series completed. But you know what? That's always good to check, because if they haven't, that's a good thing you want to complete. Let's go to the next slide. Now, Mary mentioned in the spreadsheet, there was a reference as far as how to use the or specifically pneumococcal, because we do have the new vaccine that's out, and different people learn different ways. I am a very visual learner. I like things in a picture where I can easily see it and refer to it. There are auditory learners. You can get TED Talks or recordings on it if you're an auditory learner. If you're both, hopefully my voice in this chart will send it home. But this chart is the simplest chart that I have been able to find to date that gives you on the left-hand side the prior vaccines and then what options you have as far as the subsequent vaccines. Now, key thing to remember, the new one, the Prevnar, the PCV20, it's a one and done. So you better believe I'm educating hospitals that now they don't have an excuse to not give the pneumonia in the hospital because they won't be able to follow up to see if they got the second shot. They can give the Prevnar. So that might be something as hospitals step up a little bit more to look more closely at the discharge sheets to see if a pneumonia vaccine was given in the hospital, because they do have a good option. So hopefully this chart will help. There's an addendum to this chart that, mentions specific disease states, and Mary showed a slide earlier that had specific conditions that gave some exceptions and examples, because we all know that there are exceptions to every standardized rule when you're individualizing patient care. So let's go to the next slide. Okay.
So now we're going to take
I'm handing it over to Mary.
Thanks. Sorry, Cindy. Now we're going to take a look at assessing readiness for vaccine administration and providing education, because these are two really critical pieces of your vaccine administration program. Next slide, please. Knowing where a resident is in terms of readiness to receive vaccines can really, really help you as the care provider, and it can potentially avoid a lot of frustration on the part of the resident. Whether we realize it or not, many of the decisions that we make every day take us through various stages before we finalize a decision. We may start in a place of pre-contemplation where beliefs that have existed for a very long time take some time to change. When we have enough information, our beliefs may evolve and take us to a place where we see the benefits of change, speaking in terms of vaccinations, that can make things like more freedom and peace of mind to visit with other residents and or grandchildren, etc. This is true contemplation. Preparation may be associated with external persons, you as the healthcare providers, who are trusted to provide accurate information that really moves us forward in taking positive steps toward change. And the action stage is, of course, where change actually happens. So this would relate to receiving the vaccine. Maintenance refers to the continued assurance that the action, especially if the action hasn't taken place yet, is of benefit to the resident. Of course, relapses can and do happen, but they're usually associated with what has been provided in those contemplation and preparation phases. So it's really important to make certain that you were well prepared for a conversation about vaccines. Next slide, please. I love this tool. HQI created this tool, and I think it's a very useful tool for gauging vaccine readiness. As you can see, it's intended to be folded along the dotted line so the resident can actually look at the scales during the conversation and gauge where they are in terms of readiness. Very useful tool. Next slide, please. So this slide shows some, some additional tools to assist with conversations. And I know these are very hard to see, but we are providing these resources to you. I will just say that I can't emphasize enough how important it is to exercise a lot of patience and make this time a vaccine-focused conversation. So really try to avoid doing other tasks while you're having these kinds of conversations with your residents. Next slide, please. Coupled with resources just mentioned, motivational interviewing can really provide a meaningful foundation for your vaccine conversation, especially if there's an established relationship with a resident. It's really important to actively listen during this conversation, as I just stated, and that means, again, choosing a time when you're not distracted by other tasks. It also means setting the stage for this conversation by asking for permission. Maybe this is not the perfect time for the resident to actually hear and take in what you're trying to say. And of course, you want to avoid any judgment about the residents' responses and respect their autonomy in decision making. Motivational interviewing is not a one and done approach. It may take several conversations to arrive at a place where new beliefs start to germinate and become established. Next slide, please. So if you haven't done motivational interviewing before, I can tell you from experience that it requires some practice and skill. The resources that you see on this slide are designed to assist you in your approach to those kinds of conversations. And Cindy and I are going to attempt to take a couple of minutes to role play some of this for you.
Okay, well, Mary, it's so good to see you today, and I'm glad. How are you feeling?
I'm good, thank you.
Well, I'm glad you are giving me the time. You know, we discussed at our last meeting that this next meeting, we were going to talk about the bivalent COVID vaccine. And I just didn't know if you had any concerns.
Well, I do. I'm kind of on the fence about the bivalent vaccine. I've heard and read several things, but I'm still concerned about the side effects for one.
Well, the side effects definitely, I'm sure you've heard a plethora of things. And I can tell you the side effects, anytime you get a shot in the arm, there's a chance your arm might get a little sore. But the side effects for the COVID vaccine pale in comparison to the benefits of the COVID vaccine. And I think I've heard some people say, well, I got the vaccine and then I got COVID. Well, I'm here to tell you scientifically, clinically, as a pharmacist, and we don't lie, the COVID vaccine is a dead vaccine. It's called an attenuated vaccine. So there's no way getting the COVID shot could give you COVID. Now, a couple of things about it, though. It takes about 2 weeks to get up to full potential of a vaccine. So maybe the person who thinks the vaccine gave them COVID was exposed to COVID in that 2 weeks where the vaccine was building up immunities in your body. Another thing is, and I've had a lot of patients and residents say, well, I just always feel real draggy and just don't feel good after a shot. Well, one thing is when you get a shot, you're warming up your immune system to be able to fight off that virus or that bacteria when you do get exposed to the live portion. And in building up your little army or your fighting immune system, it uses up your B vitamins. They're like the spark plugs. They're the catalysts that get those things going. And I know many older folks get like a B12 shot for energy. So if you're on the fence as to whether or not your B vitamins are low, you could always ask, could I take a B complex, before I get my shots to make sure your B vitamins, because quite often the dragginess or a headache or something like that can be due to lower vitamins. So does that help a little bit with some of your concerns?
It does. I have gotten vaccines in the past that have made me feel kind of unwell. So discussing the possibility of getting the B vitamins does sound like a good idea. And, you know, I also feel like getting the bivalent vaccine would make me more comfortable going places and participating in activities and even visiting with my grandchildren.
You know, Mary, you and I have had conversations quite frequently over time, and I know how much you care about your family and your grandchildren, and I know how much you like being with them. And it's obvious you're really thinking about these things and weighing the pluses and the minuses. And that you just mentioned is such a huge plus. The other thing is, I know you like hanging out with people in the facility. So it gives you an opportunity to, as you mentioned, feel freer to do more of the activities and engage. So I think you're really on the right track.
Yeah, I think I have a better mindset once we've looked at what can be done to kind of minimize any side effects. I think I'll be ready to get the vaccine.
That sounds great. And I'm so excited for you. So let's set up a time. I can check the next time there's going to be a clinic or the next time the pharmacist is coming on site. If they're here next week, would we be able to schedule a time for the vaccine?
That sounds good.
Okay. So just to recap, this was a great positive one. Things don't always go that way, right? We all know. I mean, I've had a man say, I was in the Army and I got so many vaccines, I'm not ever getting another one. So, you know, there can be multiple responses. And Mary mentioned it's not a one and done thing. So let's just say, Mary, why don't you give me a no answer?
Okay.
So Mary,
you know, I've thought about it. I've read a lot about it. I've talked to some of the other residents, and I'm not going to get the bivalent vaccine.
okay. And Mary, I really respect your answer. I know you care about your health. Would it maybe be okay if I just leave you some resources that you could just continue to read up on things? Because with our relationship, I know how much you like to dig down into the details. And maybe I could stop by in a couple weeks and just see if you had any questions about the additional resources that I'm going to share if you want them.
Sure, that would be fine. I just don't want everybody coming in and pestering me about getting the bivalent
And
vaccine.
I will keep that to a minimum, but I just want to make sure you have the most up-to-date information because I know you do care about your health.
That sounds great.
Okay, so that's another way. You can always offer resources if somebody says no. Don't ever give up on somebody. That would be my biggest thing. Be creative, come up with, even if it's maybe a different topic, you know, why don't we talk about how the last winter was, if you know they got the flu last winter or something like that. So I just think that's important. Let's go on to the next slide. So here is once again, another resource in the links on the slide that can be used for residents or even some staff too, for encouragement of vaccines and vaccinations overall. And I can't stress enough that everybody's coming from a different background, from a different place, have had different experiences. And it's just really important to meet them where they are and then bring them up to where you're hoping they might be in a patient caring kind of way. Next slide. Well, I didn't want my picture on this, but I didn't have a choice.
I did.
Mary pushed me. They said my picture had to go on here.
Yep.
But there were pretty much 7 questions that were consistently being asked about the COVID vaccine. So we did try to answer them in this additional resources. And then we've also got the AIM on the right-hand side, which gives some more communicating the benefits of the COVID vaccine. And once again, one resource might be better for one resident and another one might be better. That's why there's so many resources, because we have so many people coming from different places. Next slide, please.
These are also great for providing to family members. So
Oh,
keep
yes,
that.
sorry, Mary. Yes, thank you. Family members, or to be honest, like I said, staff. I mean, you want to get your staff. It's nice to not have as many call outs for illnesses. That's always a good thing. Next slide. Just a couple more resources. Okay, you guys, this is the fourth or maybe fifth time. Flu and pneumonia are really important too. And one thing I wanted to mention, because there was so much conversation about the COVID vaccine, it really might help normalize having vaccine conversations. And it makes it easier. And it also, I'm going to say it again, sorry if it bothers some people, it's a year-round effort. There is always a vaccine that you could be covering any month of the year. It's not just the fall. And pneumonia, because the COVID's probably going to be paired with the flu, technically, you could give all three at the same time. I can probably count on two hands the number of my patients that wanted 3 shots at one time. So if you know there's going to be the public push for the COVID and the flu in the fall, let's handle pneumonia now. Let's go for it. Let's get everybody up to date on theirs. If they need a second shot, fine. If they haven't ever had one, man, give them a Prevnar 20, you're one and done. Record it accurately so you can keep track of it. Next slide. So now we've come to this point, and I'm just going to say, nobody has put anything in chat, so my feelings are hurt just a little bit. So I want you guys to either unmute yourself, raise your hand, or put something in chat. I am sure hopefully we've stimulated, some thought process that there might be a question. I don't want to assume that we've covered everything so well that Mary and I have covered all the bases. So
Cindy, I was going to say, it is a lot of information to absorb. And I'm watching the chat box, and it's almost like a fireworks display with all of the things that April is providing in terms of resources through the chat box. And I just want you to know that those are also available on the HQuinn resource site. So just because if you're not able to access them there for whatever reason, you can do it later by going to the resource center site.
So does anybody have any comments or questions? I mean, are you guys doing something that has worked? I would love to hear it. I love adding things to my little recipe box that works. We got a quiet bunch in South Carolina. I bet you if you were at Charleston in a restaurant eating, there'd be more talking going on. No, John, thank you. John said, if I'm submitting an event level COVID-19 vaccine data for residents, would not the surveyors already have access to that information? Mary, if you want me to handle that, I'll be happy to.
Sure, go ahead.
Technically, John, I would say yes. Realistically, there isn't always a good connection. And sometimes there are breakdowns in the reporting mechanisms. And sometimes the person that receives the report isn't necessarily the person that is reviewing your facility's data, or they have, I don't know, a high number of facilities to review. So a lot of times if they have to go digging too far, they're just going to shoot you the question instead of doing that digging. So
and they're going to want to see visual. They're going to want to visualize your process. So.
Yeah. Oh, this is a good one. I've never had it. Should we always have a paper copy of vaccination status on hand, or can we just print when asked? Well,
you can print. I would print when
asked. You can print when asked, but I'm over 60. So I'm just going to say, I have had experiences where I knew an audit was coming up, and the day they showed up for the audit, my system went down. So if your system can be a little finicky, you might want to have some things printed ahead of time. Not to say that you should print everything, but you might want to just have a few things printed ahead of time. I
Yeah,
don't
you
think
want to
you
make
need to
sure,
print it monthly. I think you
right.
guys know your system's the best, but that's a great question.
And you want to make sure that it's up to date. There have been situations where there have been people observed in the building who were not vaccinated, and for some reason it fell through the cracks. So you want to make sure that your roster for who's in the building that day exactly matches the vaccination status that you are documenting within your records. So it's in terms of staff.
You guys, I want to thank you for the question. You have just made me feel much better. So I really personally appreciate it.
Yeah, and
If you continue to have questions, I know you can always reach out to Alyssa or Christine, and if they don't know, they know how to get a hold of us. But let's go to the next slide. Now, you guys got a plethora of resources and links in the chat, but these next slides, we promised you a list of available free resources. I'm going to say this again: find your favorites and save them as favorites so you don't have to dig. I have about 10 favorites that I always go to, and they cover most of what I need, and it just saves me time, and it gives me time to either do things with instruction with staff or time with residents, or just kind of walk in the halls. Next slide. More resources. We promised you guys a bunch. Next slide. And finally, this is our last resource slide, but our resources between South Carolina, Kansas, Missouri, and Virginia, our resource list in library will continue to grow, because when we find good ones, we save them. So if you're looking for a specific resource or want something new to add to your vaccination education toolkit, please look at some of these. Some are for the clinicians, some are for staff, some have multi-use, some are for the residents, some can be residents and family. These slides, the last 3 slides, have some of our favorites in them. You can also find these and more in our resource center. Our resource center is just hquin.org, and it's
we'll
got
put
a
that
search
link in
button,
the chat
so you
too.
can just put that in there. You can search either by topic or by setting. Let's go to the next slide. And I always like to end with something a little fun. In closing, keep conversations positive and encouraging. I know, because all of us are stretched thin, are busy, are doing the best that we can. Continue to reach out, be patient, and educate often. And that goes with everybody on the team. Maybe some funny visuals will keep staff encouraged and reminded to talk about vaccines. This is one of my favorites, and I'm going to date myself. It reminds me, those of you that are old enough to remember the old Raid commercial where that can would spray and the bugs would just fall over. Well, this is a vaccine and the bugs are just falling over. So I hope you guys have enjoyed today. Next slide. Mary is your main key point reach out person. If you have any questions about the presentation, she knows how to get a hold of me 24/7 if she doesn't have the answer. We really have enjoyed the time with you all today. And at this point in time, I just want to thank you for everything that you're doing. Collaboration is key, and we're a part of your team. And I will say this, we're a free part of your team, a no-cost part of your team. So use us whenever you need us. Next slide.
Please don't hesitate to contact me via email or phone if you need anything.
And can't thank the front line, the leadership, the staff enough for everything that you guys are doing to help keeping your communities, facilities, and residents healthy. And we also, Mary and I want to thank you for allowing us to present to you today. I'm going to hand it back to Alyssa at this point. And we're on time, I think, Alyssa.
Thank you so much for a fantastic presentation. I was taking notes as you were talking and thinking about how we can incorporate these different tools and resources into creating that program in a sustainable method to ensure our residents are taken care of on an ongoing basis. So wonderful information. For those of you that have joined us, thank you so much for your attention today. As Cindy and Mary has indicated, we are available to help and can answer any questions for you. We want to put a plug out for our next meeting on April 27th. We are changing this month. We've changed our quality leader sessions in conjunction with the Navigating the PHE, that we're meeting on the second and fourth Thursday of every month. We've got some amazing presentations coming up on falls, sepsis work, looking at disaster preparedness and understanding the staffing measures with the new 5-star ratings and how they're impacting that guidance coming forward. So stay tuned as the calendar starts to build out. We've got about 13 different presentations in various stages of securing and confirming those appointments. So lots happening. We're very excited for a wonderful summer coming forward of good information. I also did want to plug that this month, April, is the Advanced Care Planning Month. So this is a great time here in South Carolina to really understand and acknowledge our residents' wishes and obtain that information so we have it on file. So as that person changes or their condition modifies, we're able to advocate for what's important to them. So it's a good month, a good reminder for all of us to think about our advanced care planning processes and how we're looking at moving that forward. So with that, we hope you have a wonderful week, and we will see you in 2 weeks on April 27th at 11 a.m. for our next session. Thank you, everybody, for joining us, and we'll look forward to speaking with you then.